Hi, I'm Tony Williams, and this is Brooklyn Savvy. I'm Tony Williams, and this is Brooklyn Savvy. We are so pleased to have Dr. Monica Sweeney as our guest on this episode, and what makes it so special is we are now in our 15th season of Brooklyn Savvy, and Dr. Sweeney was in one of our first episodes in our first season. So we're doing a little bit of a flashback. We want to see where things are now when it comes to AIDS and HIV. But before we turn this segment over to Dr. Sweeney, let me introduce our Savvy panel. We have Ellen Saltpeter. Welcome back, Ellen.
Thank you. So happy to be back.
Great. Phyllis Whitethorn and Colette Ellis. Now, I think, Dr. Sweeney, when AIDS was really in the news, really a disease that there seemed to be a lot of public health concern about, I'm not hearing as much. So has it, I don't want to say has it gone away because it hasn't, but what's going on that we're just not hearing about as much? It's not in the news as frequently and dominating the medical type headlines, health headlines.
That's because the people that are being infected now and dying are not the people that were as early in the epidemic. The Hollywood people that Elizabeth Taylor worked hard to get money for, the Rock Hudsons. And
You're talking about white males?
White males. The white males are still getting infected, but they've moved on from AIDS politics and advocacy and policy to marriage equality. They're not very much engaged with HIV much anymore. Marriage equality is their new thing. And there's where you see a disparity. Who's getting infected now primarily and where? Black males, especially young black males. And the epidemic has moved a lot to the South. That's not excluding Washington, D.C.
Right, where I was reading it's 1 in 7 men have the HIV virus, I guess. Would you do me a favor, though? AIDS, HIV, can you put the distinction there? Since It's been a while since we've talked and thought about AIDS.
Okay.
Yeah, we might want to.
So, HIV, human immunodeficiency virus. And that's what you get infected with the virus, just like you get infected with other viruses. AIDS is when it is advanced, and there are several definitions that makes it go from HIV to AIDS. So a bit of good news right now is many people, the white gay men I was talking about, they get infected. They are not in denial. They go to their doctors. They say, I'm infected with the monster. They start their treatment, and they live with HIV and don't die.
Do they still pass it on? Meaning you still pass it on, though, do you not?
Well, that's a good question. I'm going to go back to that, but I'm going to tell you about AIDS, and then I'll tell you why it still gets passed on. So HIV is the name of the virus, human immunodeficiency virus. You get infected. If you go and get treatment right away, you can live almost a normal life expectancy with HIV.
But is that on antiretroviral medications?
That's on antiretroviral medications. You can live almost a normal life. The man who headed the AIDS Institute in Albany was infected with HIV, and I can talk about him because he went public with it. And that's a very important point that I hope we'll get back to. Being public about your infection is very important. So he was infected with HIV. He even advanced to AIDS because he had it before the antiretrovirals came in. But he went on treatment, kept on working this tough job that you have to put in many hours. He even worked from his hospital bed occasionally when something would go wrong because he was under treatment. He monitored what he was doing. He stopped whatever was negative that would impact him negatively. But what happens is you get infected, and you can have years before you know you're infected. But while you don't know you're infected, it's killing your immune system. Your T cells which are supposed to help you defend against diseases, are being eaten away. And you get down to 200, that's one definition of AIDS, 200 or less T cells. Another definition, when you get one of the opportunistic infections, pneumocystis carotis pneumonia, there's 20 or so of them. So even acne or dermatitis can go all over your body. You can get kyphosis sarcoma, that's the purple stuff.
Right.
So there's a definition that has been established over the years which makes you cross the line from just HIV infected to AIDS. And many people in our communities are already at the AIDS point when they get to go to the doctor.
Why is that?
I'll tell you why. People are in denial. I would just tell you that the women that I used to ask to get an HIV test years ago, they say, I'm monogamous. And then I would say, what about your husband or your partner? They say, well, I know he's in the street, but I hope he's doing the right thing when he's out there.
Well, man.
Not once did I ever say if he was doing the right thing, he wouldn't be out there. I never said that one time. But women would get infected. And then I learned that not only men were giving it to women, there were some women who were giving it to men because they were out there too. So one of the reasons that it's already AIDS is because we're in denial about our partners. The other reason, we don't get tested. I don't need to get tested because I only sleep with one person. Well, it's not who you sleep with. How many does he sleep with or how many does she sleep with? The other reason is when you get the diagnosis, you often deny it and say, I don't believe it. And you just, I feel fine, nothing's wrong with me.
Man, you got to be in some kind of denial, though. What kind of headset?
As much information is out there now about that, you can be in denial and say, I don't feel anything, so I'm not infected. And then when you get the medications, you call them poisons and you don't take them regularly. And if you don't take them regularly, they become resistant to the antiretrovirals, and then you have to not stop one, but all three, because you can only treat with three. And so our people are gonna get healed. They're not gonna believe it. God's gonna heal me and take this curse away from me. It's not true. It's something
Do you think that's cultural? I mean, in some communities, because I was thinking also about this notion of, bioethics and medical testing and people who, do I want to get the breast cancer test? Or, with HIV, it's a lot of the, HIV led the way in terms of having knowledge about a disease at one point that really was going to kill you pretty quickly. And now, as you say, people have a much longer life expectancy if they are in treatment and take care of themselves. But I think there's a real question in some communities of, I don't want to know, that denial.
Is it cultural or is it educational?
Both.
Yeah.
It's both.
Because I'm of the culture,
it's
sort
both.
of. Right, yeah.
And there's distrust of the medical system.
Right.
And is there any wonder that people distrusted after Tuskegee that went on until the 70s?
Right.
And so people are just saying that it's another thing to make black people look bad. And yes. And the medicines are poison and you're just giving them to us so the drug companies can make money.
Kind of like vaccinations, the same kind of argument. Same kinds of arguments. Vaccinated.
In the meantime, the people are dropping dead all around you.
What about the gay for the stay? Meaning, I'm thinking about the prison population. Does that have anything to do with the fact that you see an increase in the HIV virus in black women? Does it, or have there been studies that have looked at that?
No, absolutely. Yes, absolutely. There have been studies. And when the community is robbed of all of these men that are sent to prison, often without unjustifiably, then there's sexual networks. You know what a hummingbird is like? Hummingbird sticks its beak into the flower, but it never lights down. I always call it the hummingbird effect.
Right.
And so women have multiple partners and men have multiple partners because there's a dearth or their man is away in prison or they don't have a man. And so there's this hummingbird effect. Yes, that's one reason. There's another reason. When I was assistant commissioner, we did a little study that was so small we didn't publish it, to ask whether there was any benefit to becoming HIV positive, infected, I call it. Do you know that in this small sample, 1/4 of the people said yes, that there was benefit?
And what is that benefit?
And what is that benefit? Okay, I'm glad you asked. Because what they say is, when you ain't got nothing, you ain't got nothing to lose. And what do you get when you're HIV infected in New York City? What are the bennies? People used to ask me, what are you gonna do to stop people from getting infected to get the bennies? I didn't know the first time they asked me about the bennies what they were talking about. So what do you get in New York City when you are infected with HIV? You can get an apartment.
See, we didn't know this.
Didn't know that.
I don't, maybe we shouldn't be sharing it.
What?
You can get, I'm glad you said that, because here's one of the issues. People come to New York from everywhere because there's never been a waiting list in New York State to get medications for treatment.
Right.
Whereas in the South particularly, where they
Right.
don't give a damn about
And
the people infected,
Right.
there's a waiting list. You don't get anything. So you get an apartment, you get job training, you get immediately on Medicaid, you get more money in your welfare check than other people. You get so that you can go from place to place to get food. There are many nutrition and food pantries that are specifically for people with HIV.
You make it sound really easy, like that you just show up
Right.
and you can get all those things. I'm sure there's some bureaucracy.
That takes maybe 10,
Yeah.
There-
14 months, 15 months.
No,
Wow.
no.
Whoa.
More than once, people have said to me, when you ain't got nothing, you ain't got nothing to lose. And there have been people who've said to me that becoming infected with HIV is what put me on the right course in my life, which is a damnation of this system that you have to be infected with an incurable disease
To think that
to
you can
get
get
the
help.
help that you need.
But that may be, well, I don't want to say may be true in New York. That may be some people's experience in New York State. But let's look at Mississippi, where these fellows are left to die. In most southern states, people who contract HIV and get full-blown AIDS are left to die.
Not to mention around the world.
Right.
Not to mention around the world.
Right.
They're starting to do better around the world, though. About 1/3 of people now around the world are on antiretrovirals, which is a lot of improvement from when I was on the Presidential Advisory Council for HIV/AIDS. That is improving. I have to say that in New York City, if we could get the young black men who have sex with men. Now, in the black community, if a man has sex with a man, he gay.
That's the way.
That's the way it is in the black community. I just want to say that's the way it is in the black community.
That is very true.
And with all the gender fluidity, that's not changing?
No. And that's why the down low is so prevalent, is what's called the down low is so prevalent in the black community, because we don't entertain bisexual and sexual fluidity and no. If you have sex with a man and you're a man, we call that gay, homosexual. I don't want to have anything to do with you sexually. And that's another thing that infects women. There was this major person in a big church, I think he died recently. He would take boys out of the country. He had this big born-again Christian church. He would take young boys out of the country to have sex with them. And out of that, a man came out and said, we all knew it. And there were men in the church who knew it and who had been engaged with this person until they got too old and he got the young men. And one of the men who got infected said, you can tell I will confess to my family that when I was out of town, I had relations with a prostitute, but not with a man. You can admit to having gotten sex from a prostitute, but not with a man. So there's a lot of stigma.
Maybe we should stop judging. Maybe that's
Yes.
what needs to happen. You know,
We
maybe,
should.
Maybe
Absolutely.
our culture, you know, and I'm just speaking right now since we're speaking about black people. Maybe the culture is just too judgmental.
But
Just
what is
let
it based
people
on?
be themselves.
What is it
Well,
based
people
on?
are going to be themselves, and they have
What
every
is it
right
based
to be.
on? What do you think it's based on?
The Bible.
Of course.
The
it's
Bible.
based on what we
the
were
Bible,
raised
what
on
we
in
were learned-
Deuteronomy.
That's right.
You know, it's a sin for a man to lie down with a man like he lies with a woman. And there's so many people still church-based that that's what they base it on. And here's what happened based on our judgments and our stigma.